Tams from Dr. True's office. Glad you tuned in to see us today. Thank you so much, and don't forget to like us on Facebook. I'm kind of feeling tired today because I've been on vacation. I went to Florida, had fun, but Dr. True, what could I do to help? I'm just kind of dragging a little bit today. What could I do?
Well, there's no question going on vacation can make anybody tired, but if you are tired on a chronic basis, we can do some things. As far as Tams, I think she needs to probably rest a little bit after vacation. What do you think? She already has hormones because we do hormone therapy. A lot of people, they complain of tired, there's just no motivation, they can't seem to get with it, they drag home at night. This is real common, and a lot of times it's secondary to just lack of hormones. So this is something that we can do to help, is to increase your hormone level. So the idea that we have is to give you bioidentical hormones. These are hormones just like you had when you were younger, just like a young fit woman or a young fit man in their 20s. Those quantity of hormones, the same identical types of hormones as they do, in the levels that they have. Because people want to increase the thought process, clarity of mind, and a whole bunch of other things that will help you to feel good and have better quality of life. But let's also talk about one other thing about hormones, and that is the safety of the hormones. Hormones are safe if you give the right ones. Now, we're talking about giving you hormones just like the young women and young men have. So you don't see a lot of those young women or men having breast cancer or having strokes or heart disease, because they don't cause that. These types of hormones do not cause those kind of problems. There have been studies that have suggested that if women are on hormones for a long time, that they get some problems like that. However, those are not the bioidentical hormones. All the studies that show bioidentical hormones are safe. We recommend bioidentical hormone therapy, and it'll boost up your energy, make you feel good. And if you continue with hormones over a long period of time, you have a decreased risk of a lot of medical problems. Things like heart disease is less. Things like osteoporosis, degradation of the bones, that's less. Things like Alzheimer's disease, believe it or not, if you take it over 10 years, there's been significant studies show that there's a decrease in Alzheimer's disease. A lot of things you can do. It'll help you for your health, but also help for your energy.
Yay! We need energy. I think it might be time for my hormones. So let's go find Lori and see what we could do about that. Thank you, Dr. True.
You're welcome. Bye-bye.
Let's go talk to Lori and see how you get a hormone pellet, okay? Come on, let's go. But first, let's stop in and see what's happening in surgery today. Hello. Everyone wants to see you. Say hello. What are we doing today?
Today we're doing breast augmentation.
All right, let's go. Okay, see you later, Kim.
See ya.
Let's go. Lori, where are you? Let's go find her. See, I'm already feeling better because I'm just thinking about getting my hormones. That's all it takes, is just thinking about it. Okay? Lori. This is Lori.
Hey, Facebook.
Yes.
So I'm guessing that Dr. True told you a little bit about bioidentical hormones today and the benefits of them, but this is where the magic happens, and this is where we get the hormone pellets in. There's a few ways you can get your hormones. There's creams, and then there's another way, which my favorite way would be hormone pellets. I brought one in here today. These stay sterile until they go in your body, but for today's purposes and demonstration, I'm going to show you one of the pellets. This one's actually a testosterone pellet. So I like to tell my patients they're about the size of a skinny Tic Tac. And this little pellet, believe it or not, is going to be inserted. It's pretty easy insertion. It's kind of like when you go to the dentist and you get a little shot of Novocaine to get numb, and you can do what he wants, you don't feel it, same thing. Little injection on the back side, and then it's in. 3 months, it'll melt a little bit every day, and you'll get your hormones. It's like having your own new little ovaries again. So we do estradiol and testosterone for most postmenopausal women, or perimenopausal and beyond, but we've control on getting it, but they're feeling run down and tired, weight gain, fatigue, can't remember things well, they get just the testosterone pellet. So we see all types of patients at different ages. We even see men too. I think we think about women and menopause, but we forget that men go through andropause, which is low testosterone, which is normal. You get to 40s, 50s, their testosterone cuts in half. But we're living longer these days. It was just a few generations back, our grandparents, the average life age, was 45 or 50. But as we're living longer and we're feeling good and we're looking good, I'm 2 years away from 50. But I don't want to feel like 50 or how my grandma felt at 50. So we do anti-aging. So we can get these pellets in and get the hormones back of where we were in our 20s and 30s and feel like that again. And so it's not only about what's on the outside, it's about how you feel on the inside. So that's a lot of what we do here. And we change couples' lives all the time. We hear nothing but good stories and good feedback back of how it's changed people's lives. And once you're doing that and they get back to working out, they can gain more muscle mass. A lot of us lose about 7-8% muscle mass as we age, so it helps replenish that. Libido, I think all couples for a healthy marriage and healthy relationship don't mind that perk. And I would say number one is just the fog. The fog is lifted and we can think clear again, and a lot of that's related to testosterone. So that's why our patients keep coming back every 3 months. For the females, you have a pellet inserted once every 3 months. For the men, they only do it 3 times a year. It's once every 4 months to be feeling good and feel young again.
And Lori, it doesn't really hurt, does it?
No, it doesn't hurt. It sounds a little intimidating having a pellet put on the backside, but like I said, it's no worse than a little trip to the dentist. It's the injection. The initial stick is over in a few seconds. It's definitely worth the payoff of what you're going to get for that.
How long do you think it takes? 5 minutes maybe?
For me to put pellets in, about 5 minutes.
Yeah.
You know, it takes a little bit. We're going to discuss your symptoms and discuss how you're feeling, and then the actual procedure is very quick.
Yep. And she's really good, let me tell you. She always does.
It's my favorite thing to do. I've been doing it for over 7-8 years now, and seeing the benefits, and it's really satisfying to help people. So
yes, she's great. She's great. So if you feel tired, you want to come in and have a consultation, the consult would be covered by your insurance. If you have insurance, you just need to pay your copay, or if you have deductible, it would go toward that. The pellets are not covered by insurance. $350 for female pellets, but that's for 3 months worth, and about $675 for the men, but that's only 3 times a year. We have package deals for that also. So we want you to come in and have a consult. I want you to see Lori, Dr. True. You'll always have to see Dr. True, of course, first to get an evaluation. We'll probably do a little blood work. That's usually takes about a week to get back, Lori, right around there.
You'll come in, meet Dr. True, you'll be given a lab slip. We can either draw your labs here. Most of the people choose to go to the lab in their neighborhood. And then return, discuss the test results. Dr. True will find the appropriate dose for you. In 6 weeks, you'll go have your blood work again to see if that dose got you to right the peak where we wouldn't want you to be. We could either decrease it or increase it. We start a little bit slow, that way we can work up. We don't want you to have any side effects that are undesirable, and then we find that's the best way to do it. At your next visit, we may be bumping your dose up again, and usually that's pretty satisfactory, and you can stay there, and then your check-ins are pretty quick and easy. You don't have to keep doing the blood work all the time, maybe once a year or so. So it's pretty easy to do.
And I think one thing that we really haven't mentioned too much was the night sweats that it helps with. And in the summertime, we get so hot as women, and I guess probably men.
If you're suffering with the night sweats, you know, I know when menopause hit me early, didn't even think about it. I just knew I was waking up and the sheets were soaked and my clothes were soaked, thinking, oh, it must be the down comforter. Right. The minute I got on hormones, I figured out it was actually my hormones. They were gone in 24 to 48 hours. Yeah. Didn't have it happen again. So I think we don't even realize those changes are happening. And then there's tests we can do too. Some women, maybe they've had a hysterectomy like me. I didn't know if I was in menopause because I didn't know when I stopped menstruating. But there are ways we can check your lab levels to see if you are in menopause or near menopause. So that's always interesting to find out for us with a hysterectomy.
Absolutely. So we've got lots of things we can do to help you. Lori's great. We've got a couple of other nurses that do pellets too, but Lori's been here the longest, of course, so we really love her. We love all of them. So, well, thank you so much for tuning in today. I'm so glad you did. And please like us on Facebook. My name is Tams. I'm with Dr. True and Dr. Rivera as well. Will be coming on staff with us very soon here full time. Please call us and make a consultation for hormone pellet therapy. Well, of course, if you want any type of cosmetic procedure done, we can do that for you too. Just give us a call, 817-399-TRUE, or visit our website at truemd.com and fill out a consultation sheet. Thank you so much for tuning in. We'll see you next week at 1 o'clock on Wednesday.